Okay, watch this. Did you get the picture of me?
He is a bright, very hyper 5-year-old, and he's super intelligent and very loving.
Do you want one?
I'll take one, yeah, thank you very much.
Sometimes I like to share.
Thank you for sharing. Thank you. Oh, these are great.
He was being very violent. He even knocked over a large full-size dresser onto the ground, and I was scared he was going to hurt himself. So I ended up calling the police. They come back and say that they don't have any beds open, so they're going to start calling the other hospitals. And you're waiting for hours and hours, and by now a full day has gone by that you've been in the emergency room with your child. And they'll come back and tell you, oh, since he's under 8, no one wants to take him. He'll either have to wait for a bed in our hospital or go out of state. He wasn't doing well at all. He was not being seen by a psychiatrist while he was in there. When we would come and sit with him, it's like, can I go home? Mommy, when can I go outside? He didn't want to be stuck in that place anymore. And I felt like I was the one keeping him there.
What happened to Brian is known as boarding, when psychiatric patients in crisis are forced to wait because there isn't the staff or room to admit them. Instead, they languish in emergency departments for hours, days, sometimes even weeks.
It is day 8 of Ellis's hospitalization. If I take him out, I will lose our place in line. Places are so limited for a 5-year-old.
So this is our behavioral health emergency department. As you can see, it's a very small unit, woefully inadequate for the volume of patients that we see. The children are confined. They can't leave that space. There is no place for them to go.
If I'm going to be here, what's a typical length?
Sure. It's hard to say. 8 days ago, we had a patient who'd been here 15 days, in this area for 15 days. The longest stay currently is 5.5 days.
You must feel kind of helpless, putting it mildly.
Oh, I don't feel helpless. I'm pissed. That's just not right. That's inhumane. It's unsafe. It's non-therapeutic. They're not getting the care they need, and it makes me angry.
The wait is longer than I've ever seen it. And the children needing hospitalization are sicker and need hospitalization more than I've ever seen.
Honey, I just want the doctors to see how sick you are. Hey, buddy, can we just please work through this?
No, I'm dead! Stop recording me!
Okay, I love you.
I'm gonna die! We're gonna get through this. I don't want to do this. I'm gonna die!
You like that hat, huh?
Yeah.
I was afraid you were not going to like that.
My son is Jonathan, and he is just turned 16, and he has a diagnosis of cognitive delay along with mood disorder and anxiety. He was saying he was going to break a window and use the glass to cut his wrists. And he was saying that someone was telling him to do this. I'll never forget it. We were there, it was like 8 days, and finally they found a bed.
So he sat for 8 days in the emergency room?
Yeah, in the emergency room on a gurney.
These are either Silkies or Polish. This is the Wells Summer.
We've waited 3 days, 5 days, and then the ultimate was 21 days. You know, they looked in all of New England, New York, some as far away as Virginia, trying to find beds for her. And there either weren't beds available or they turned her down.
So your daughter was being turned down not just because there weren't enough beds available, but because in some cases they thought she was too ill.
Yes. Yep.
I get that all the time.
Yep. So it's like, you know, walking to an ER with a gunshot wound in them saying, oh, you're bleeding too badly, go out in the parking lot, we can't really help you. Yeah.
We call it reverse triage, right, where the concept of triage is you do the first things first, and the first things are anything life-threatening, et cetera. And with psychiatry, often the opposite is happening, where the less complex patients are moving out relatively quickly, even if they're boarding for 1 or 2 days. The more complex kids are waiting for very prolonged periods of time.
So sometimes the most severely ill kids are the ones who wait the longest.
Correct.
Psychiatric care is usually thought of as something that costs the system, not that is bringing in dollars. And therefore it is so difficult to get hospitals to think about developing additional services or even investing in hospital beds. Even more importantly, we don't have the intensive outpatient children's mental health services that would help avoid the need for emergency room visits.
We as a society make decisions about what we value. And when we decide not to value children and adolescents, when we decide to close mental health resources for those children, when we decide not to provide preventive services or continuing services as outpatients where they can go and see a therapist and have their problems worked out before they escalate and become suicidality or homicidality, when we don't value those kinds of resources, this is what happens.